Hello and welcome back. It's great to have you on again.
Yeah, thanks for having me or inviting me again.
Yeah, of course. Unfortunately, we aren't talking about what is it, Berserk again yet this time. Maybe next time. But we're
Yeah.
talking today again about uh, something related to pain, but more so looking into how you would diagnose pain, or not pain, but joint pain specifically, how you would treat those sorts of things.
hmm
Um, but to start off, what have you been up to since we last met?
I'm trying to think. What have I been doing? I taught a course in Austria, actually in Vienna, in 2025 in the beginning of the year. And then I am going back. I have a in-person course coming up in Colorado in May. And then in early November, I have a course in Prague and Vienna. Um, And then we'll see what 2027 has in store for those things. I started working on a systematic review this year too, um, having to do with like looking at issues in tendon, like research on that, and like if we can see anything with like if stretching affects um, treatment outcomes or anything like that.
That's super neat. We'll probably talk a little bit about that today as far as like, how stretching helps, but I'd love to, read more on the outcome of that. So curious, how did you end up teaching a course in Vienna? And it seems like you really liked it because you're going back.
Yeah. So I had started posting on my social media asking about like where people might want to have courses because I'm like, well, if I can get enough people, then it financially makes sense to like, okay, go there. And then it's like, well, then I get to travel to some of these places that are pretty cool. Um, so the clinic there had reached out to me that they were like, hey, we're actually starting an education like branch of our company to help bring more evidence-based practices into Austria and just Europe in general. Um, so we worked it out and ended up teaching there, and I was there for about a week. And it was really a great experience. I mean, it's a pretty city. There's obviously a lot of history there. Like it's been there since like 50 AD, and I think like there has been some sort of like either Roman settlement there or human settlement there since well, Romans wouldn't have been there since the Ice Age, but just after the Ice Age.
Yeah. Yeah, very unique and rich history there. And so what exactly were you teaching there? Was it related to diagnosing or treating joint pain?
It was mostly centered around like lower back pain and like all the things that can go into that and like pain, like common diagnosis, what we call red flags or things that we consider to be like sinister pathologies where it's like, okay, this person needs to go like have surgery or, they might have an infection or something that like they shouldn't be seeing a rehab professional for. And then see the diagnosis, treatment, like some case studies, like stuff like that.
I see. Was this at a university?
It was at a like an outpatient clinic that works there, and they have their like own education branch. They host courses. They also partner and work with a lot of the high level athletics in Austria, actually. Yeah, they cover a lot of sports like their national like I think basketball. They work with some really high level tennis players, volleyball. Um, uh, I don't think American football, but definitely track and field, soccer, like all sorts of things like that. I think I don't know if they've had any people that were in like the Olympics, but I know like, um, at least one of the therapists that I've talked with a bit there has gone to like, different like, European, level competition or gone with them like, national teams to like international competition and stuff like that. Because there's, in qualifying for the Olympics, like, uh, national, international level like competition where you have to qualify.
I see. That's pretty neat. I was actually going to ask you, because at the time of this recording, the Olympics are going on, if there was any Olympic athletes, but still nonetheless pretty neat to see. So I was curious, uh, just going to jump into the general discussion here right away. With injuries, we used to be told to rest and ice, right? So
Hmm.
elevate, rest, ice the area that's affected. So this is typically can be muscular pain, I suppose, is sort of where that stems from. What is there any evidence that this actually helps? And if not, why is that the case? Or what else
Yeah.
should we be doing?
So there's like a mixture of evidence now. So like the extreme end of like the rest ice compression elevation, which was like we called it like the rice, has been like kind of like started to go away from that just because like with an average everyday injury, as long as they're not like super excessive amounts of swelling, um, there's some research that says like if you just focus so much on like reducing the like swelling and inflammation like too much, it can actually interfere with natural recovery. Just because like inflammation is a part of the body's natural like forms of like jumpstarting healing. It's just managing it to the degree where like it's not excessive to where it's like, okay, this amount of uh swelling is significantly interfering with like everything you can do. Whereas like some, if it's tolerable amount and you can still go about like what you're doing, like it may be worthwhile to like let that be there so it can heal well. Because if you just take like mega doses of like anti-inflammatories and you're like constantly icing it and like wrapping it, it could potentially delay a little bit of recovery because a lot of the swelling includes like chemicals that your body uses for like healing stuff. And it's kind of interesting because like the way you can think about like swelling, it actually it would wax and wane. So it comes and goes. And it's dependent on like the um actually like pH and stuff in that area. Whereas your body looks at it as like, okay, these chemicals we use for healing can be very noxious to like sensors that are there, essentially tell you about like danger signals. And chemical irritation is one of those things. And so your body actually sends more fluid to the area to dilute that, and then that swelling will dissipate and it'll get more concentrated. Then your body goes, okay, I got to dilute it more, and it'll go up and down, up and down, up and down as you go.
I see. So what exactly is inflammation? Like, how would you define that? Because oftentimes, this whole idea, like you mentioned with rice, we're trying to reduce the swelling, but inflammation is the body's natural response to uh, an injury. So what
Mhm.
exactly is that?
Inflammation is like a collection, and it's like an interaction between your nervous system, the endocrine or hormonal system in your body, and the immune system to say like, hey, there's something going on here, and then your brain can register that because your brain can at times actually like it's not you doing it, but the brain is consciously delaying it depending on the circumstances you're in. That is a possibility. Um, where it goes, okay, I need to start our repair process. And normally that does start in what we would call the periphery, so outside of your like central nervous system, where it just like naturally goes, okay, I know I need to do these things. Um, and it's just a normal process, and this in this conversation of like repair and turnover when maybe an injury or damage has actually happened versus like I think where people think of as like so inflammation being bad, it's when it's like across your whole body and like a constant like either low or potentially high level, and that's where it becomes like not beneficial for us. And then you see like a higher instance of like certain diseases and things like that associated with those things.
I see. So when inflammation is more so isolated to one area, it's not as much of a problem. But if you're experiencing inflammation throughout your body, then that would be more cause for concern.
Yeah, because that's where we see like issues with like like hardening or plaque buildup in like arteries or like you see that with like diabetes or like the whole host of different things we might associate with like obesity and like negative health consequences of those types of things.
Yeah, and I'm curious, and speaking of, whole body inflammation, there's been a huge uh fad recently, well, probably in the past couple of years, with cold plunges. And I was
Mhm.
curious kind of, what was the science behind that and if that is even really useful for possibly reducing whole body inflammation, or if there's actually even any benefits of doing that other than posting it on social media and trying to look cool.
Yeah. So generally the benefits from that is more like psychological, like the fact that you can overcome and do something that's like hard and challenging and very uncomfortable, and then like improve your ability to do that over time versus like if you're otherwise healthy, um, in theory, it can actually, it is enough, depending on how long you do it and how cold it is, to actually blunt like actually your hypertrophy and like recovery of like muscles and joint tissue and stuff like that because it's like it's such a high level of like where it would like interfere with like that normal level of like inflammation that's good. It can't, it's not like a huge amount, but it is enough to be like, hey, when they've done research, like I know Brad Schoenfeld has posted some papers, and I think his lab has done some studies on this where they found that like, hey, like we noticed that like if you were doing this like regularly or like right after, especially like weightlifting or something like that, it had some minor interference with like normal muscle repair and like growth. Um, so like maybe that's not like the wisest thing to do it for like those reasons. But like it has like psychological benefits, but you could get that psychological benefit out of doing just like almost anything that would be kind of like hard, like purposefully.
Yeah, that makes sense. Now, on the other side of the spectrum, there is like saunas and things like that. So essentially, you're
Mhm.
saying it's okay to take a warm shower. You're not going to ruin your progress in the gym. Uh,
Yeah. There's actually some research that shows that like almost immediately post workout, like it's not enough to be like you should just be changing your whole routine, but like there is some benefit that like that and like high level of amounts of massage right after, like within like a few hours can improve the recovery.
I see. So actually doing uh, saunas or taking warm showers instant could actually be somewhat beneficial.
Yeah, it's probably like a small amount versus like for the average person, like just like getting, trying to get better sleep, stress management, like mindfulness techniques or like whatever, stress reliever type things, eating, drinking, all the things that we should be doing, that we don't all do always are going to be more beneficial.
Yeah. So eating a balanced diet, getting sleep, all of those things are probably going to greatly improve your recovery much more than well, and stress management much more than just having a sauna would.
Yeah, yeah. It's like, okay, if that's nice for you and it fits it within the time frame that you have and stuff, but it's like if you're really crunched for time, like there are other things that I would focus on first.
Yeah, of course. So back to sort of talking about injuries and recovery and ways to recover. What is the timeline on healing tendons? So, we're gonna, well, I guess we should define first the difference between tendons and joints.
So tendons are actually like where the muscle, so like I don't know, give me a chance to flex. So if you're like looking at like your bicep, right? For example, like so in the middle part where we associate with like the muscle, or you look at any bodybuilder, like that is the muscle, and then your every muscle has 2 points in which there's like a tendon attachment. So depending on where it is anatomically, it's called either the origin or the insertion. And it depends on like if it's closer to the midline or middle point of the body or not is determines the origin, and then the insertion is usually further away. So like for your bicep, there's a point at which it attaches to your radius bone in your forearm, where that then takes the force from the muscle and exerts it on the bone to produce movement. And the same with at the other end. It doesn't. The proximal or like closest point, the origin typically isn't maybe producing movement per se. But that's kind of a whole different discussion. It's just the point at which the muscle transitions into for the bone to then produce movement. So they act like a force, um, like transducer, essentially. It's like a joining point.
I see. So those are tendons. And then
Yeah.
for the joints, how would you describe a joint?
So joints are typically areas where like bones come together. So say like on my finger here, where like two bones meet and then there's some space in between. There's usually some um like an end cap of the bone is slightly different than like the long part of the bone. As well as like there's usually some cartilage, and then most joints also have what's called a joint capsule, meaning it's like connective tissue that encompasses it, because then the joint produces its own lubricant called synovial fluid. Um, and a lot of tendons, not all of them, go across multiple joints or at least one joint to then cause like we call it like articulation, so movement of that joint so we can do stuff.
I see. And with the timeline on healing a tendon, so obviously I assume there's different levels of severities of injuries with tendons, like
Mhm.
partial tears or versus full tears. And I'm assuming, the severity of actually injuring a tendon can be very, possibly almost career ending in some case. What is the timeline on healing tendons?
Yeah, so they do heal a lot slower than muscles because so if you're to look at like even like a piece of meat, right? So the red part that you're going to see, that's what we think of as like that's the muscle, like on a steak or something. Or even like in a chicken breast. Like we all know that like chicken breast has on the tenderloin, there's that tendon that runs through it. And that's actually what your tendons look like. They're like that, they're white. And it's essentially because they don't have very good blood supply. Um, and they're meant to be non like vascularized or just much less than like a muscle versus a muscle has a huge blood supply in it. So like some muscle injuries can recover within like a couple days. Like for an experienced weightlifter, the amount of like stress you cause because there's physiologically a phenomenon. It's called the repeat bout effect, where when you initially start an activity, you may cause some low level muscle damage, but then your body essentially figures out how to prevent that from happening again. Um, and then really what you're seeing is that stimulating like a muscle or causing an issue to it is that there's a mechanical stress on it, like a stretch or some kind of swelling or different things like that. And that's just telling it like, hey, I need to get bigger so that I don't get damage that happens. So if you regularly are doing that, that's happening. The tendon will get some adaptation from that too, but it takes a little bit longer. Typically, they get like either stiffer or less compliant, like less like kind of stretchy, and that's a good thing because then that means the tendon more efficiently transfers the force that the muscle produces to the bone. And then you want the bone to be healing well too, because there are some conditions where you see like especially like on the knee at the point in which the patellar tendon comes down and attaches to your lower leg. Like some kids, for instance, will have really big bony prominence there. That's called Osgood Slaughters. If there's too much stress, you do see that it can start to almost like pull away that bone a little bit. Um, you can see that sometimes with like at the Achilles, where you can get like what's called a Haglund deformity, or it starts to get calcified because it's just not able to keep up with recovery. A lot of tendon issues outside of surgical repair tend to not like really, they can heal, but it's like not very good. But there's a lot of like misunderstanding in the public eye of like what that means because like you may not actually need that tendon to fully be like normal for it to be functional. And there's more and more evidence coming out about that in a lot of different areas of the body. And some of these issues may always like tendon issues, like what we call like tendinopathy, what most people would probably still call tendonitis. there is a little bit of deformity in the tendon that sometimes even on an MRI or ultrasound can look like a tear, but it's what's happening is that because it's been stressed more than it can recover from, it actually tends to build up more so collagen protein, so it builds up more protein there, and it looks like it gets like bunched up, and sometimes that can look like a tear. Usually radiologists are pretty good at differentiating that now, um, but that can happen. And that will always look like that once it's that way. But there's still like a big portion of people that are either never have symptoms with that, or if they do have symptoms with that, we don't really know why they have symptoms because a lot of these changes are also systemic. Like if you have it on one knee, you're probably going to have it on the other or somewhere else in your body. So it's like, well, why did it hurt this time, but not like these other times? So there's still a lot we're trying to figure out. And the timeline is dependent on like also how big the tendon is. So like your quad tendon in your knee, where your kneecap sits, or like your Achilles, are going to take much longer as far as like healing times to see like physiological changes. But a lot of times with now everybody kind of knows like load management and then like reintroducing stress, so then graded and gradual exposure. Typically, those issues can become less symptomatic in either days to weeks or within like 2, 3 months, and then it might take that tendon kind of like a year to a year and a half to fully be um like significantly better, even though when you take a scan of it, it's generally going to look pretty much the same.
Yeah, that makes sense. You touch on something that I want to talk about a little more as well. So you mentioned load management and using that to help people rehab without damaging or overworking themselves. How do you go about doing that?
Yeah. So that's the tricky part, right? Because like that is like probably most of what in rehabilitation we're doing is like load management, and we're figuring out like, is this something or someone that's at the point where they need to be exposed more? Do you need to pull them back? And then also like, what's this person's like mental state like that too? Because like that makes a big difference. Like our confidence, to engage with things, it makes a big difference on like whether or not somebody's going to want to do it. It may also affect like the amount of pain that they have when they try and do things because of like that heightened response that's like uh it's there for a good reason. Like evolutionarily, like our body and brain is doing everything it can to protect you and keep you alive. And so it doesn't necessarily care about you really thriving more than like, oh, are you alive? Like, do you have the hierarchy of needs? Are those basic needs being met? And if they are, and you're still doing a lot, your body may also decide to be like, well, you're still just going to have pain with this. And, there's no reason for me to get rid of it because it goes, well, you're probably expending less calories, you're moving a little bit less, you're doing things that are maybe more cautious. So you're more likely to be kind of around. And for the most part, like our bodies want us to have excess, body fat and everything like that because of like it's good for survival. Um, it's just now that our modern lives make food accessibility much greater. So you get like a lot of complicated things in there. And so I'll look at like, okay, what's this person's like normal life like? Are they already doing a lot? And is there any benefit to me adding more? If that's the case, then I might actually pull them back a little bit more. Some people you're doing a little bit of combination of like you'll pull back certain activities and either replace them with other ones or find modifications for those while adding other things maybe they're not doing. Like if like when I've treated like I just had a few people that were power lifters, and it was like, okay, well, you do this a lot. Let's do these things that you probably don't do a lot of because it'll just introduce a novel stimulus that you can recover from and be exposed to. Um, and then also like what's their confidence? Like what's their um like body language like, or what are they explicitly telling you about like their confidence to do things again? And then the extent at which you're going to expose them and how you're going to do that will then change based on those things.
How do you know when soreness and pain are no longer normal and healthy? And how does that differ between younger people and older populations?
When they no longer, that's a good question because it's like it depend on the injury that somebody has. So typically a lot of nerve pains are always excessive. Um, like so things like what most people might call like sciatica or like radiating nerve pain like from your neck. It's always going to be more pain than you actually need to recover and be a benefit. And then we also typically like think of as like we just kind of know from our schooling like what some healing times are for certain injuries. And so like say if like somebody sprained their ankle, I would typically expect that to continuously to get better over time, like every day over day, week over week. You're gonna feel like that's better. And if it's not, then that's like okay, it's and um and also we look at different characteristics, like how do they describe the pain? Is it very predictable? Is it not? What caused it? How much pain do they have? How long is it there for? Those are all things that tell us kind of like what might be contributing more to it. Like, is it because there's like a learned physiological now behavior of the tissue or the nerves that communicate what's going on there? Or is it even sometimes that the brain is like looking for a reason to be more protective of that area? And then that would dictate then, okay, how do I teach this person about what's going on with them and how we're going to expose to it and things like that.
I see. And I have two more questions for you. I'm curious, does popping joints do anything? Is that something that you should be concerned about?
So typically no, because like again, we're not really sure what's going on there. Like some people think it's there's like some gas buildup potentially in there that you're like hearing move around. There's some stuff that like that capsule that I talked about could be moving, and that's what you're hearing, or the tendon is kind of just slightly shifting. Our joints actually make a lot of noise. We just typically don't attune to it because our brains are good at tuning out stuff that's not important. Um, but then like we might notice it more when we have like pain. There was actually a rheumatologist, which take this for what it's worth because it's just one person, but he actually did for like decades, like cracked his joints on like one hand and then was taking regular like x-rays of both sides and found that like it didn't affect the joint whatsoever.
That's really interesting because I've heard various things about, I guess you could say like myths about people cracking their joints and then, oh, there's gas or fluid buildup in there and you need to, don't crack your joints, it's the worst thing ever. And like, I feel
Yeah.
like every 5 minutes I crack my knees and my knuckles. So that's good to know. When it comes to sore muscles, a lot of people like to use the kinesio tape or that tape that I don't know, I've never used it before, but you put it on and it's supposed to add, I believe, compression or something and help out in some way. How do you feel about that? What do you think is the possibility of that being useful?
So I think in most cases it's probably not as useful as people like think it is. Like there's at least just not like a lot of great evidence that it's like going to make a worlds of difference. There's a possibility in some cases where it's like enough of like a biomechanical like change or like a sensory change that somebody might notice like a significant difference. And if that's the case, it can be a good option as far as like, okay, it doesn't take a lot of time to do it, and you might notice like a lot of benefit from it. Like, for some people, like maybe the position of their kneecap, for instance, like it can sit in a certain way that's like kind of uncomfortable, and it might be related to just like your natural um like size and shape and stuff like that because everybody's like slightly different. So like some people naturally their kneecap might sit like further up into the groove that it's there or down or one side to the other. And so like putting that there can help it to track differently and that feels nicer for you. Or like on your foot, like there's what's called like lodi taping. It's like meant to kind of bunch together like because on our foot actually the pad is kind of similar to like the tissue here, so it's like meant to bunch it together more so that you have more cushion because some people will have like a either not a significant amount of like fatty deposit there or um, be losing it for whatever reason, and that causes discomfort with like stepping or running or stuff like that. Especially because it's like pretty hard to change your like striking pattern if you naturally strike one way. That's why like a lot of the running stuff now recommends actually figuring out like how you strike and then getting shoes that match that more than anything.
I see. So it's more about comfort than it actually is preventing or possibly treating any sort of injury, or it's basically just a way to deal with discomfort.
Yeah, and change like where you're maybe putting some stressors for could either be short term or like that's just like a good way for you to do it, without because like there's a possibility that if you go through enough repetitions, you could cause an injury. Um,
Yeah, I'm curious. I might have to try that out with the tape because I crack my knees a lot, and I'm kind of curious if maybe adjusting my kneecap, so to speak, would make it feel different, or even for squatting, how that might feel.
yeah,
That's interesting.
yeah.
I didn't think that.
Like for me, I noticed that with like if I do Nordics, um, I will get like a lot more knee pain, and I think it's because like I'm getting more compression of my like patella into like the joint space, and so that causes me more like discomfort versus like I can do like really excessive like range of motion knee extensions like with my cable setup and stuff and like that's fine. Like I could be in like a hip flexor stretch position. Like I don't know if you've seen like Alec Blennis or anyone like that. I've posted on my story like once or twice me doing it, but he was the first person I really saw doing it more.
I see. So really, there's also like a differentiation between discomfort and like pain and injury as well. Discomfort doesn't always also mean pain, or it doesn't always necessarily mean that it's bad for you. It just does it make you feel better? Do you feel more comfortable? And that's
Yeah.
sometimes an okay reason to use something as well.
Yeah, because like really, pain biologically isn't like it's not a good indicator of tissue damage. Like that you are experiencing damage, or that even that just because you don't have pain doesn't mean there's also not damage. Like there can be people that have like, say, for instance, like maybe eventually you could have pain. I try not to play that game because like the hindsight is always 2020. But like you see that with like stress fractures, like that is a long sustained like overuse injury that like for a while that person's probably not going to experience any pain. And then all of a sudden they like have a significant enough like fracture form that now they might have pain. And you see that with like other things too, where um, like if you tear a muscle enough, like sometimes you just won't have any pain because it's like, well, you know, there's nothing I can do about that now. And depending on the scenario of like how it happens too, what's the current stress you're under that makes a difference. Like you see that a lot with like people that are attacked by animals or like in wartime or stuff where like people get shot and they're like, oh, I didn't even know that I got shot. Or like a lot of people that get attacked by sharks, they describe this feeling of like it felt like the shark like rammed them, but it like bit off half their arm, and it's because like your system unconsciously survival mode is like, okay, like we can, you know, freak out and you could writhe in pain because your arm just halfway got bitten off, or we can kick into gear and get away from this shark, or in some cases you've heard of people like punching like alligators or like sharks or stuff like that and getting them off of them and then they go away. And then it goes, okay, we'll deal with that later. Um, but even like initial studies like on this, like a lot of injuries, like when they would look at emergency rooms, they said there's somewhere between it's like 30 to 40% of people come in that have like really, really significant injuries without necessarily have signs of like shock. Will report not having either they'll have very low levels of pain or no pain.
That's really interesting. I know we have an entire episode, the very first episode I did about 2 years ago, almost exactly 2 years ago actually, as of uh this week or something, I believe. But yes, we went deeper into pain and um talked mainly that pain is not an indicator for damage, but that's actually interesting that you brought up the point of people not feeling pain at all when they might have had a seriously traumatic thing happen to them. So that's very interesting. Seems like psychology. You keep mentioning the psychology of things, and it seems like psychology plays a huge role in our body's ability to adapt, survive, and deal with pain.
Yeah. And a lot of it too is even just like prior information. Like it could have been like something you saw somebody else do that you saw on the news, you saw in a movie, you saw in a video game, like whatever. Like your brain is like sampling and taking all that information that it has access to and goes, okay, so what's the best course in this situation? Like what should I do? Because there is some evidence too, like I was saying earlier, like if I sprain my ankle and I'm being chased by like a wild animal or there's a car coming and I have to get out of the road, um, your brain can actually override the healing, like the initial inflammatory like healing response and say, no, like don't do that right now. Because if we do that, we're going to be SOL and you're going to get like hit by that car or the animal's going to catch you because that loss of mobility and stuff is going to prevent you from moving in a way that you could get away. So it'll say stop and it can be delayed like up to 3, 4 hours later. To where then it like swells up. Like I know I've experienced that like in high school sports where I like hurt my knee in a game and I didn't really notice it until it was like we were on the bus ride home and my knee started really like swelling up.
Yeah, that's really neat. Sort of the the ability to override the pain system and things like that, or not pain system, but the body's response to an injury. I'm thinking in the future this would actually be a really great separate episode to possibly talk about specific cases like that. Like I know the first one that kind of comes to my mind is Hugh Glass and his ability to crawl, thousands of miles to, uh, I believe it was a military outpost or something like that. But I think that'd be kind
Yeah,
of interesting.
was he the sniper in Vietnam?
No, no, Hugh Glass was the fur trapper who got attacked by a bear.
Oh, yeah, yep. Okay, okay, yeah, yeah. Now I remember. Yeah,
Yeah,
because then like I know the story, I just don't always remember their names.
yeah, of
There was
course.
another one where the I can't remember his name, but there was a sniper in Vietnam and he would crawl and I think one time he took like 3 or 4 days to like crawl to where he needed to be to get to his target and like all the while like he had crawled over like fire ant nests and like stuff like that and then like he would just stay like perfectly still to the point where even once he took a shot like he laid there on the ground and he said like actually a few times people stepped on him and didn't know he was there.
That's wild. Yeah, we should definitely do an episode where we kind of look at those unique cases of the body's psychological abilities, physical abilities. Um, but let's get back to just for the purposes of this episode, I want
Yep.
to talk a little bit about how you would go about doing rehab for a couple of different cases or scenarios that I've come up with for clients. So, for instance, we have a runner, and this person has been running 10 to 20 miles a week. They've been resting and eating well, but they have a dull pain that radiates up their leg. They have a pain in their hip as well, and knees pop. should they be concerned about, maybe they're doing too much, but how would you go about treating this?
Um, so I think like for me, typically I'm going to ask them about like the characteristics of their symptoms. Like, do they have like any back pain? Do they have any sensory changes to see like is some of this potentially also related to like back issues? To be like,
Mhm.
okay, is there something there that we could address that it, sorts out some of the other issues they have? If that's not the case, um, then typically what we would do is like look at um like obviously we talked about their mileage, but like what intensity do they do? Does that affect the symptoms at all? Like when do they notice it more? Are there things that they can do that they feel better like with? Like do they notice any difference with like shoes and stuff like that? Because like I mentioned about like the strike pattern and stuff. Like some
Mhm.
people will notice that with certain shoes they actually feel better than with others because they're like maybe the design of the shoe fits better to like your style of running since like running and like walking tend to be like fairly self-organizing where like your brain it's kind of this is actually something that I find fascinating. So like when you're born, you have like the framework for like locomotion and running and stuff. But then by doing it and observing it, that's how you like form for you like what is the way that you do those tasks. Um, because there's going to be some differences in like your limb length and stuff like that. But also like it's like the template is there, but then you have to like build on the scaffolding. It's like, you might I'm trying to think of it like another good example that it's like you might have like the framework, but you have to put the house together. It's like the Red Dead Redemption house building scene.
I love that. That's such a great, that's such a great game as well, and that's such a brings me back. But yes, uh, yeah. So actually, I also have written this note here. Occasionally, this person does feel a weird sharp pain in my lower back if I kneel or squat the wrong way. So like you mentioned, this is probably something that might, like immediately, I almost said that, I would ask if they're experiencing any back pain. So you think that even though they're feeling this pain in their leg or their knee, that this might actually be something to do with their lower back.
Yeah, it's always a possibility because then it's like, I mean, generally, like I'm not going to tell people not to run because like running is good for like discs and stuff like that. But like because of how it can cause like sensory changes or almost like miscommunication, since like the nerves that come out there and then those roots supply like a certain spot. So like sometimes if you have pain in your back, and it's like around where the root is or that nerve, whatever is irritated, because it's hard to pick out like what might be irritated. It's like the brain can perceive it as like an issue in areas that also supplies. There could also be like multiple things going on at once. So it's like you're trying to differentiate that stuff and then see like, okay, does maybe changing like certain things in training make a difference? Like, oh, if we for a little while go away from like maybe squatting, like depends on like how important that is to them. Because I might look at as like, okay, maybe we do some different variation of squatting or change the depth or change the load or um tempo and there's lots of ways to change the loading by either modifying depth, modifying speed at which you do it, um like bar position, like all kinds of stuff like that. Does that make a difference? Does the way that they disperse the mileage through the week make any difference? Um, uh, People that are like typically like competitive runners will do like they'll either have like a speed day or a tempo day or a recovery run day. So like the pacing that they're running, I might also look at things like that to be like, okay, are there variables that in there that we can just tweak a little bit and they'll feel a lot better?
Yeah, that makes sense. But really, really plain, I guess you would say that's kind of what the load management part comes in to be, right? When you're dealing with this sort of joint pain.
Yeah, yep.
Yeah. Now, I have another example here. So we're going to move over to someone who's strictly just a person who lifts weights. So this person is a lifter. They lift 4 to 5 times a week. They do minimal cardio. And after their deadlifts, after their squats, they have a sharp lower back pain. This person has tried doing a foam roller and stretching, but still experiences the pain. What, how would you go about treating this, or what should they do differently?
Um, so like some of the first things I look at is like what is it like always after that? Like what loads do they talk about? Like percentages or like repetition amount that they're doing that day. What else are they doing in their sessions those days? How long is the pain there for afterwards? Like do they also have any stiffness with that? Things like that. Um, and then we may make some modifications. From there, I'm trying to think what else. They don't do cardio. Usually I'll have them add in cardio. Um, as another form of like, okay, like we can make you like make the system more efficient and healthier to encourage like positive improvements. Um, we might look at like, okay, what's your bar position? What's your, do you pull sumo or conventional? Things like that, and even look at if there's like just ways that we can help them be more efficient in those things. Um, or like if there's like, oh, you have might have developed like a habit in the lifting that like maybe like unnecessary, like for you to do that, and then that like changing some of that stuff could make a difference. Also, like I've had lifters that I've worked in the past that were doing like excessive amounts of like warm up time that I was like, I think you're pulling energy away from actually your main lifts. And also like when in the session, if like squatting and deadlifting is particularly important to them, like when are you doing it in your session? Um, because that can make a difference. Like actually, some people feel better if they were to do some accessories first and then do it, versus others are going to want to go in and be like the freshest to do that.
Yeah, that's kind of interesting how you talk about moving the accessory work around. And for people who are unfamiliar with that, accessories are anything outside of the big three, which is squat, bench, deadlift, essentially. So doing some of that stuff first and then doing the quote unquote main lift. That's that's uh that's very interesting too, how you mentioned, warm up time might be too much. I know in my past experience when I first was started learning deadlift, I was stretching too much. And I found that actually stretching before working out for me is not even efficient. And for me, I might do a little stretch before I run, but typically um, I don't stretch all that much. And if I do, it's usually before bed.
Yeah. And usually like this is the thing too, is there's not really a lot of evidence that like says like stretching actually reduces or prevents injuries. Um, and they've actually directly compared that with like it was like stretching, stuff like balance or coordination training, and then like strength training. And strength training by far has the largest effect on um injury. So really like a warm up isn't meant to be like, oh, I'm trying to work on mobility, because depending on what you want mobility for, you can actually achieve that by just training through like a fuller range of motion. Um, so then really it's like you're trying to warm up by actually you're increasing the temperature of your body, and telling your body like we need to be prepared to move or produce force or things like that and get into more of that like prepared zone. Um, and it's not saying that like you should not ever warm up, but like also like there's probably times where people are fine like 99% of the time and never warm up or do anything, like like your body, if needed, will do what it needs to be in that state. But there is some benefit performance wise to like increasing arousal and body temperature and stuff like that.
Yeah, of course. So basically, do what makes you feel comfortable, but not in excess.
Yeah, don't do more than that than what you need to, because then you're probably just like wasting time.
So now, uh, how would you go about treating joint pain in like elderly people? So let's say, people who are maybe more stationary, maybe don't have a the ability to get around as much. How would you go about treating that versus like the athletes that we just mentioned earlier?
Yeah. So with them, there's a lot of other levers to pull, like um, how much are they sleeping? Do they know for them like how much they feel like they need to sleep? Because that's also a little bit different for everybody. Um, Sometimes they may be limited on like what they can do, and then they might feel like some of the people that I see are like, oh, I want to get my joint replaced. They won't do a joint replacement until I lose X amount of weight. Like, but I need to be able to move more to be able to lose weight. So then we look at like two, like say it's your knee, like, okay, well, there's a lot of other things you can do that cause you to move more and expend more calories. Um, Without necessarily needing to put stress on your knee. Like we can do a lot of movements, your arms, like we can introduce some like forms of cardio, like just like sitting and marching, like a lot of things like that where we may be targeting not necessarily around that joint at first, but then we start to transition to more direct. Like having a lot of strength around your quads, for instance, is something that we know like seems to be beneficial for knee function. We know that like 98% of what creates an outcome for somebody who has knee arthritis is kind of not really well understood. Like we have vague ideas, like we call them context factors. And then like 2% of it is that you get stronger quads.
That's funny. So basically, do your squats and you'll be okay.
Yeah. So like I might have them do like transfers for us or like anything where you like get up and out of a chair or up and off the floor, out of bed. So I might have them do like sit to standing from like a surface and be like, okay, what's a comfortable amount for them? Like, I may start people with like, okay, sit on pillows or sit on the armrest of like your couch and do that, or holding onto the sink and just sitting down to a chair. Um, Stuff like that, just doing like knee extensions, like where you just kick out without any weight even at first, or like just simple like leg lifts to the side and the back while they're standing, stuff like that. And then, it's like, okay, do they even know what a fruit and vegetable looks like? You know, Most Americans probably don't, as much as like they put protein in everything, probably still a lot of people might not eat enough protein or in theory, like you could space it to be more optimal, but really your body doesn't care as long as like the total intake is there. But you still need a stimulus, especially as we get older. You actually might need once you reach certain ages. I mean, I know you do know this because you went for nutrition science, but you do reach a point where you have anabolic resistance that you have to think about where like that person might need more protein just because the stimulus isn't there and you need a stimulus to drive that change to get positive recovery.
Yeah, of course. Yeah, your nutrient needs are going to change over the course of your life. Especially looking at, like populations of like older women that are postmenopausal.
Yep.
Now their amount of iron that they need goes is basically cut in half. That's also the one micronutrient that I know for a fact that women actually have a higher RDA for than men do. So yeah, it's a combination of sort of diet changes and sort of lifestyle changes when you're looking at these elderly people. What are what about these artificial joints or joint replacements? How do you go about treating people with joint replacements? And for anyone who's like considering getting an artificial joint, what are the pros and cons of that?
Yeah. So like the treatment afterwards is like it's a lot of I mean what we might call like the scientific term for it is like habituation. So you're just like acclimating them to like, you know, the fact that like a lot of stuff gets taken out of that joint and then that causes a lot of like changes to happen. Um, we just don't necessarily need to like go into all of those, but it's like what you're trying to do is essentially go, okay, what's the range of motion like? What is considered functional? Can we get them there? And you essentially have them start to habituate. So, okay, you're having trouble with like bringing your knee up towards your chest after you had your hip replaced, which affects your ability to like bend down or like put shoes and socks on. So, you know what? We're gonna have you purposefully do that more often, and poke into a little bit of discomfort, or like with your knee, like you're gonna bend it or straighten it. And here's a bunch of different ways we can do that, essentially to allow them to acclimate and your body to learn that that discomfort doesn't need to be there anymore. It's like building up calluses on your hands from lifting. Like at first, it's like, oh, this doesn't feel that great, but then eventually it's like, okay, that doesn't bother me and it's positive. Um, and then you're trying to normalize just their strength because there's going to be strength changes either because of like the surgery from like some of them, like a hip replacement and stuff, or shoulder. Like Shoulder's more extensive because most of the time they actually physiologically change. So like it goes from like your shoulder joint to being like a cup and a socket to like then they reverse it. So the head sits on your body and the socket is here because it gives your deltoid more leverage. Because typically if you're getting your shoulder replaced, your rotator cuff is irreparable. Um, so you're trying to normalize strength so then they can lift like usually overhead and like have the strength to like even just pick something up and put it up on a shelf. Um, for hip, if they go from the side or the back, sometimes they'll cut through the glute muscles a little bit, and then that affects people's like walking, and that affects your ability to go up and down stairs and like get up out of a chair and stuff. So you're working on that. Um, Knee, they don't necessarily go through the muscle, but it's there's such amount of inflammation that that inflammation, even like because even a teaspoon of inflammation in the joint space of the knee can um we call it like it inhibits your quad muscles so they don't fire as strongly just because it your body can sense that. Um so you're trying to like, okay, work that stuff out. It does take time, normalize that so they can do the stuff they needed to do. So like I talk to people like the reason why we're looking at getting a joint replacement is because like you have either potentially already tried stuff or you're to the point where like you're not getting the function out of the joints that you are looking for. And so now like getting a replacement would actually improve your function and quality of life. You will have more mobility or less pain that prevents you from engaging with stuff. Where some people are like, well, I don't think I'm there yet. Like, if somebody's still like recreational playing like even like pickleball potentially, and they're doing it without much pain or discomfort, it might, or if you're playing like tennis, it might not be worthwhile to get like the joint replaced because some people will notice like a decline in their function. Or if they're doing like I remember this case where the surgeon I was listening to him talk is Ian. His name's Ian Harris. He's a researcher out of Australia. He had a patient that wanted to like play volleyball, and he's like, "Yeah, if you get your joint replaced, you might not actually feel like you can play volleyball as well. So maybe like let's not do that right now." Or like if people are still like like downhill skiing or stuff like that.
Yeah. So so maybe so maybe artificial joints are sort of a last resort, or not a last resort, but something that, that's not the first thing that you want to consider when you're looking at treating pain, especially in older people, because it might actually limit their function rather than improve it. But it's sort of depending on the case and severity. I'm assuming that someone, I'm assuming that someone who is in need of an artificial joint probably has tried a lot of other methods, or at least before you would recommend someone get an artificial joint, you've probably gone through the gamut of any sort of rehab possible, and this is probably the best option for them that might actually improve it.
Yeah, that's what we want. I think like research wise, like we tend to see that people are often not recommended to do certain things when they should be. Like at the time points at which we first recognize that they're having an issue and they should be recommended to do like these lifestyle changes, they're not being recommended. So by the time they get like to the point where like they might see even me before they have a replacement, they're kind of like at the point where they're like, I don't want to do this because like it's been so long already. Versus some people do come in and go like they're adamant that like I don't want to have it replaced. What can I do? So there's like a disconnect because like we do see that like physicians and caregivers, or medical providers, right, know the guidelines, but they're just not like maybe always recommending them. And there's probably multiple reasons why this is the case. It can be very difficult to get people to engage in those things unless they specifically also bring them up. There's a lot of qualitative research, meaning like where you ask people about their experiences. And we tend to see that unless somebody brings something up like weight loss or making certain lifestyle changes, they're likely not going to unless they've engaged in asking about it versus you just telling them to do it. The only and except for like we tend to see like with exercise, if it is recommended and you can for every 12 people you recommend to exercise, at least one of them probably will and will continue to for up to a year, which is the lowest out of any like lifestyle change. So like I think like smoking and dietary changes, it's like one in every like 75 to like 200 you have to like recommend versus like exercise like one in 12.
Yeah. Yeah. That's actually kind of crazy, but that would make sense. I mean, I think it's easier to um I think there's, especially if you're coming from a point of complete inactivity, it's easier to increase your activity than it is to um, sort of change your entire diet, especially if you don't have that knowledge, that working knowledge of adjusting what even is a macronutrient, right? Like a lot of people don't may not even understand that, there's three macronutrients and fats, carbs, proteins, and you need certain percentages of your diet should be each of those. And then there's a whole
Yeah.
slew of micronutrients, and that can be very daunting to someone. So that's interesting that you're looking at also probability that someone might do something to even make like minor improvements in their life.
Yeah. And I think like you've probably seen this too, and I've seen a more like focus on this in the nutrition world where they look at it's like the additive behaviors more often now. So like they look at additive behavior. So like, can you add some fruits and vegetables? Can you add like eating beans here and there? Or can you easily switch from just eating white pasta to like, oh, I go to like I know Berea makes like the plus and it's like noticeable the difference in the taste where it has like more fiber in it or oh, could you go from drinking like a full sugar soda to a diet? Like
Yeah.
minor changes, like those are probably ones that people are going to more likely do.
Oh, 100%. And I think even as someone who, as a person tracks my nutrition and everything, everything that I eat every single day and exercise, I'd say that even from my anecdotal experience, that making those additive changes, even at the, I guess almost the atomic level, right, of like knowing how to adjust your load or being able to say, well, I'm still hungry. What can I do? Well, I should probably add more fruits and vegetables, which is typically always the answer. Especially when you're in like a caloric deficit, like those things take up space in your stomach. I mean,
Yeah,
spinach can be very dense, fruits and like I love like berries, blueberries and things like that. That stuff all takes up space and is filled with like fiber. So I think that, yeah, I think that, that maybe rather, I think that can also have a really profound psychological effect on someone about like adding something versus taking it away, especially when you're in the very infant stages of making life changes like that.
yeah. Some of the best ones that I've had success with patients too was like not that like I was like, you don't have to not indulge. You could probably still, for a lot of people, I was like, eat all the things that you are still like eating now, just have a little bit less of them and you will probably lose weight. And one of the guys that I had worked with had noticed that and like I think like the few months that we worked together, he had lost like 10 pounds by just doing that.
Yeah. Yeah, every little thing counts, and I think that's a very important thing to keep in mind. And I think we could probably should probably have another whole episode on psychology related to the mindset behind recovery and everything like that. But
Yeah, I was gonna say I do this one. I jokingly call it boy dinner, where I have like it's like 2 cups of berries, either like a tablespoon of cocoa powder, 2 scoops of protein powder, uh, obviously water, and then either like flaxseed or chia, and then like it fills an entire blender up, and like I'll be full from that for like 4 or 5 hours.
yeah, yeah, I eat a lot of chia seeds. I found that they are very filling. That and bananas and fruits as well. So I want to move over to a overview on sort of joint and tendons before we wrap up here. So what is joint pain caused by, and what are tendon injuries typically caused by? Do you have sort of a understanding of where you can point to where these things might originate from, or is it usually a case by case basis?
So usually it is case by case basis. I mean, some of what we do know about like tendon issues is that there's like systemic issues going on with a person. Sometimes like in like genetics plays a part, lifestyle, um, nutrition, sleep status, like all that stuff, like obviously plays a role. There are some people that are more predisposed to some issues than others. Um, some people think that there's something to do with like compression of tendons, like when they are moving, say like your Achilles, like if you're stretching it out, like there's like a extent at like which certain loads can deform the tissue uh past like the extent that you need to like produce like a positive adaptation, and that could lead to like long-term issues. We're still not quite sure on like that yet. Like the like mechanistically it makes sense, but we're not sure like does that actually affect like the outcomes yet for people. Um, and then there's like joint pain can be a lot of times it's like overuse, and it's not necessarily always related to tissue damage. It could be just related to like tolerance, and then like it's always possible that it's like the body is just like, hey, like I don't think this is good for you, so that you're gonna have some pain.
Yes, that harkens back to episode one where pain isn't always an indication for injury. So I also had one other question for you, stretching. So this is something you mentioned that you might be working on a little bit more in the future, but seeing how that affects tendons or treat rehabilitating or strengthening tendons with stretching. Is that is there any benefit to doing that? Is there any reason to do it as well, especially as we age? Because a lot of time people will tell you you should stretch every single day so that way you keep your mobility or whatnot. Uh, what do you think of that?
I think unless you have some sort of mobility or like ranges of motion you want to get into that you may have limitations of getting into, like that would be a reason for someone to stretch, or because you like to you it feels nice. That's a reason to stretch. But like um I think the reason why it's been like stretching recommendations have been taken out of the activity guidelines from like the ACSM and World Health Organization is because of like it doesn't offer unique benefits to your health as in like how like cardiovascular and strength training would. And strength training through like larger ranges of motion can offer mobility benefits too. Because really you're not, there's some debatable evidence of like, can you add muscle tissue in like series, like through the length of the tissue versus like when we typically build muscle, it's like around like my finger, like making it longer, which I have seen some studies actually where they've been able to stretch like a joint or something and add length to like certain tissues. But it typically requires like loading programs that are like either not super feasible or would take like, a minimum of like 20 to 30 minutes a day of like purposefully like taking something and stretching it in a certain way or like bending that area. Um, Like there was one done on like Achilles and stuff like that. Um, so it doesn't necessarily add tissue, although it can in some specific scenarios. Um, so it's most mainly like you're actually just developing a tolerance to being in those positions more so, and then eventually where like when you get to that point, like you kind of reset the sensory tissue there to say like, oh, this isn't past your capacity. Like now, so I went from here to maybe like here. Um, and if you just want to do that because you can, that's fine. But if otherwise, like I would say, don't worry about it unless it's like preventing you from doing something.
Yeah, so essentially, if you want to learn how to do a split, go ahead and slowly stretch, but it's not necessary. It's not going to change
Yeah.
your life. It's not going to mean you're unhealthy if you do or don't.
Yeah. Yep. Yeah. That's why like they for the longest time too, they had gotten rid of like on the presidential fitness test, like the sit and reach and stuff like that.
I still remember that, yes. And it's such a weird thing because you have to like rock back and then push really far forward. It feels rather than just like simply stretching, it feels almost I don't know, a little dangerous.
Yeah, it's forced in a different way.
Yeah. Uh, so I was curious, just have one more question after this, but where can people go to find out more about your work and what kind of services do you offer for people looking into rehab or dealing with joint pain?
Yeah. So really right now I just treat in person like at my like outpatient clinic based job. And then otherwise I offer like courses that I've been the courses that we talked about earlier. And some like mentoring for like clinicians. Um just because it had gotten so hard with like kids and balancing life to like treat outside of like my normal day job. Um, but I have like education stuff that you can find on Instagram, TikTok. I had been posting it on YouTube a little bit too, but like I don't always remember to cross like post because I think I have presence at least on YouTube, TikTok, Instagram, LinkedIn, Upscrolled, Blue Sky, and Threads.
I see. So when you're not doing your physical therapy, you are full-time father.
Yeah, dad, husband, take care of a house, trying to do my own training, sleep, all that kind of stuff.
Yeah. Well, that's wonderful. Thanks for sharing, Well, I'll put that at the end of this video so that way people can go and check it out and perhaps reach out to you if they have any questions. So just one last question for you. What advice do you have for people struggling to get into the gym or struggling with joint pain?
If you're struggling to get started, just find something that you do like and that you feel like you can do consistently and just do it. You don't have to be perfect. It doesn't have to be the best. It doesn't even have to be like a long period of time. If you can just do something even for like a couple minutes a day, like you're better off than if you weren't doing it at all.
I think. Good advice. Well, thanks for coming on. I really enjoyed getting to speak with you again, and we'll see you again probably in another future episode. This is actually really wonderful. I think this is almost like a 2-year anniversary for me or something like that since the last time I
Yeah.
recorded. Maybe
Well,
3, something like that. But this is kind of full circle, so it's really cool to get to speak to you again,
yeah. We'll have to make a date of it sometime.
for sure.